Hello, this health talk is about the keto diet or ketogenesis diet. The keto diet was developed to treat epilepsy, not weight loss, but it has since then been used to treat everyone that is interested in weight loss, or they have epilepsy, or they have certain neurological disorders. The main types of keto diets are the classic ketogenic diet, or CKD, the low glycemic index treatment, or LGIT, the medium chain triglyceride, which would be abbreviated MCT. So it's the medium chain triglyceride oil diet, or MCTOD, the modified Atkins diet, or MAD, and the modified ketogenic diet, MKD. Thanks to the Boston Medical Center's website for much of this information. So, if it's good for epileptics, does that mean that it's good for everyone? Well, let's take a look at each of these diets that are designed to help epileptics. The classic ketogenic diet, CKD, is the original keto diet and was developed by Dr. Russell Wilder of the Mayo Clinic in 1923 to treat epilepsy. So no, it's not a new diet. It's an old diet. It's just been popularized in a way that it was not intended to be. You need to weigh everything, and your calories are 90% fat, 6% protein, 4% carbs, or with a ratio of 3 or 4 parts fat for every part of protein and carbs. The diet is tailored to each individual to ensure adequate nutrition and can be adjusted as needed. The CKD is reserved for infants, small children, and those receiving enteral feeds due to its restrictive nature. The diet needs to be regularly monitored by a medical professional so it can be adjusted based on test results. Okay, the second one is the low glycemic index treatment, or LGIT. It was developed in 2002 by Dr. Elizabeth Thiel and dietitian Heidi Pfeiffer at Massachusetts General Hospital. It's an alternative to classic keto. It places emphasis on the intake of complex carbohydrates over simple sugars, restricting both the total amount of daily carbohydrates and the type based on what is known as the glycemic index, or GI. Glycemic index tells us how much sugar is in the food, which suggests how much of a spike in blood sugar there will be. It doesn't tell us the release time frame, however. You need to have your health monitored during the use of this diet. One of the problems with GI is that it is a poor indicator of how the food will release carbs into your bloodstream. For example, any food with a low GI is going to release sugar slowly, which would be a lot of the complex carbohydrates. But food with a medium or high GI may have a completely different level of release. So something with a high GI may have a high glycemic load, or it may have a medium one, or may even have a small one. Now, glycemic load, or GL, is you take the glycemic index times the number of carbs and divide that by 100. And that will give you the glycemic load, which gives you an indication that's more accurate as to how much of a risk of a blood sugar spike, a rapid blood sugar spike, I should say, you're in with each given carbohydrate food. Low GI and low GL foods release slowly into the bloodstream, which reduces the chance of an epileptic seizure, as well as the negative consequences of a big spike of sugar in your blood. Now, that is not part of the Boston Medical Clinic's website. That is from separate research that I did. That little part about GI and GL, okay? Fat and fiber that is eaten with carbs helps determine how quickly the sugar is released, and thus meal composition is important. Meal sizes are determined using household measurements with a max of 60 low GI carbs per day, plus a balance of fat and protein, making it rather different from CKD. The MCTOD, or medium chain triglyceride oil diet, is also kind of different. Because of MCTs, less fat is required in the diet, which lets you eat more protein and carbs. Food is divided into exchange lists so you can interchange based on your preferences, meaning this is the most flexible, although you do have to measure and have the ingredients or their accepted substitutes available. It's best to divide up the required oil between all meals and snacks to reduce the risk of your body displaying intolerant reactions. This diet can be used as an outpatient diet, but consistent long-term laboratory and medical surveillance is still necessary. The next one is the Modified Atkins Diet, or MAD. It was developed at Johns Hopkins Hospital in 2003 by combining the Atkins diet, which was created by Dr. Robert Atkins in 1972, and CKD. This was developed shortly after he died. This diet is high in fat, just enough protein to meet your body's needs, and very low in carbohydrates, 10 to 20 grams a day, based on age. The diet uses a 1:1 to 2:1 macronutrient ratio. Food is measured using household implements such as scales, cups, and spoons, and constantly checking the nutrition facts panel and ingredients list to identify hidden carb sources. This is an easier diet to follow for those who frequent restaurants because of the selection of low-carb foods available in them. Due to its flexibility, you can use it on an outpatient basis, but regular medical surveillance and lab checks are required. When followed correctly, it has been shown to be highly effective in controlling epileptic seizures. As a note, claims of the relationship between Dr. Atkins' heart problems and the diet, I don't know if he ever even used it, as well as the cause of his death, are hotly contested on Snopes and the Atkins website, and MAD only came out on the year of his death, 2003. Opponents of his diet claim that it's what caused both his cardiomyopathy, a heart problem that affects the heart muscles, and the blood clot. Actually, the blood clot may have been caused by atherosclerosis or plaque buildup in blood vessels, but we don't know. That others claim was a result of the fall he had on a sidewalk in 2003. Coincidence or coordinated change between Johns Hopkins Hospital and Atkins Company? Who knows? One doctor who doesn't like this diet claimed that when he was on the original Atkins diet under Dr. Atkins, he struggled to stay on it, and Dr. Atkins yelled at him. Truth? Or just another story? I don't know that either. Alright, so the fourth of the medical keto diets is the Modified Ketogenic Diet, or MKD. It's a more lenient version of the classic diet. It may be used to transition someone to the LGIT or MAD diet, or because the patient cannot, for whatever reason, meet the dietary requirements. The diet uses a 1:1 to 2:1 macronutrient ratio, just like MAD, but can help reduce tummy troubles caused by eating a lot of fat. Of course, it requires medical monitoring. Now, those are the 5 main types of ketogenic diets. You may find other keto diets out there that are variations of one of these, but the Boston Medical Center describes keto diets like this. The ketogenic diet is a high-fat, low-carbohydrate, and nutritionally adequate protein diet that alters the body's primary energy metabolism from carbohydrates to fat. Doing so creates energy-rich compounds known as ketone bodies that serve as the primary fuel for the brain and extrahepatic tissues. And hepatic means liver. The ketogenic diet has been used as a medical nutrition therapy for years in the treatment of refractory epilepsy, though marked benefits have also been seen in patients with neurodegenerative disorders, brain cancers, and obesity. And that is from their website, www.bmc.org/pediatrics-neurology/epilepsy/dietary-therapy. So what do experts say about the keto diet? Multiple medical and diet experts say that it reduces or even eliminates type 2 diabetes and causes weight loss, as well as reducing issues for type 1 diabetics. I have queried those on the keto diet, and they've told me how wondrous it is and how well they're doing. I don't have access to their lab results, of course, and I don't know how long they've been on it or how much they know about their lab results. I wish them well. However, doctors do warn that for those consuming animal fat and protein as part of the diet, over the long term it can promote diseases like cancer, arteriosclerosis, which is narrowing of the arteries, atherosclerosis, which is arteriosclerosis plus plaque buildup in the arteries, high cholesterol, and high LDLs, and it may also lead to various autoimmune diseases, including lupus, urticaria, and asthma, and cause dementia and other memory issues due to plaque buildup in the brain, and possibly other diseases. The problem remains that if it contains too much saturated and trans fats, and meat naturally contains both, and also a large enough amount of carbohydrates, it may eventually cause diabetes. This would be highly unlikely with patients who are using plant-based keto diets, however. The culprit is the animal products that are often recommended when suitable plant-based ones could be substituted without ill effect. My podiatrist has noticed an increase of gout amongst people who eat a lot of animal protein because of the upsurge in the popularity of protein-rich diets, which he theorizes are keto diets, although I'm not really sure that which keto diets might actually be protein-rich. It would certainly include other kinds of well, not necessarily only keto diets, but diets that have protein from meat, the Schwarzbein principle, and the paleo diet. It should be, the keto diet should only be a short-term diet for most people and should not be used as a lifestyle or long-term solution unless a medical condition requires it. Because it is low in fiber, it can also contribute to irritable bowel syndrome, constipation, and hemorrhoids. So, that is my take on what I've learned about the keto diets that are out there. Now, I'm pretty sure that the 5 that I've named are not the only kinds of keto diets out there, and that there are others that are being called keto diets but don't actually fit the category. So you might want to take a close look at the diets that you, or the diet that you are on, and might want to consider trying a different diet unless this is really what you need. If you are on the keto diet, I do encourage you to make sure that you regularly have your blood checked for different problems in different parts of the body. Thank you very much for watching. Stay healthy, and I hope you have a wonderful day.